Nutrition in pregnancy is very important. In the first trimester, it's kind of all about getting through it. We have a lot of food aversions, nausea, vomiting, and we're just not feeling great. But in the second trimester, it's really important to focus on a healthy, well-balanced diet. We really only need about 300 extra calories a day in pregnancy, so it's not actually eating for two. We want to focus on a diet low in simple carbohydrates and high in healthy fats. And we want to avoid any foods that can give us a foodborne illness. Most commonly in pregnancy, we think about listeria. Listeria can come from unpasteurized dairy, which is often your soft white cheeses, brie, feta, queso fresco, cotija, those type of cheeses. Also raw bean sprouts and cold cuts like your deli meats we would like to avoid as well. Any undercooked meats, so your steaks need to be at least medium and no sushi, unfortunately. Caffeine is safe in moderation. About 200 milligrams of caffeine can be safely consumed throughout pregnancy. My name is Dr. Mauney. I'm an OB-GYN at Houston Methodist Willowbrook Hospital. I've been here since 2018, and I'm currently the chair of the Department of OB-GYN and Pediatrics. The best way to calculate your ovulation would be through an app, some sort of menstruation app, and that can often tell you when you're ovulating. However, not every single patient follows the textbook. So if you're really wanting to know when you're ovulating, the best way is buying an over-the-counter ovulation predictor kit. It will be some sort of stick that you urinate on, and you start that after your period and continue until you notice that you're ovulating by whatever the manufacturer's recommendations say on the instruction manual. After having a baby, menstruation can return at a different amount of time for different people. Most women will resume menstruation within 3 months of giving birth. However, if you are exclusively breastfeeding, you may not have a period at all during that time. If you're pregnant and you notice a little bit of spotting early on in your first trimester, that's likely implantation bleeding and overall usually very normal. Now, if your bleeding is heavy, like heavier than a period, you're saturating through more than one pad or so an hour, then it's important to reach out to your doctor.